who have really struggled to see a dentist, so that we can again say the dentist will see us now.
Jane Hunt.
Thank you very much, Madam Deputy Speaker. And may I first of all congratulate my honourable friend, the member for Waveney, and the member for Bradford South on securing what is quite clearly a very important debate. May I take this opportunity excuse me, to once again thank you, thank the, those in the dental profession in Loughborough and indeed across Leicestershire for everything they've done over the past few years, and in particular the way they adapted to implement the huge changes needed to ensure the safety of their patients throughout the COVID-19 pandemic. This year I've met, excuse me, just a moment. My apologies. This year I have met nearly all the dentists in my constituency who have highlighted a number of issues they are facing and how this is impacting on the profession and the patient experience more broadly. One such concern is about the UDA system, with the recurring message being that the system, in its current form, thank you very much indeed.
Would she give way?
I certainly would.
I think the points, Madam Deputy Speaker, my honourable friend is making are particularly important to constituencies like her own, which have got towns but are also rural.
Thank you very much indeed. The member for Gloucester is a true hero in every way. One such concern is about the UDA system, with the recurring message being that the system in its current form is not fit for purpose. I welcome the package of initial reforms to the NHS dental contract, which was announced in July, and in particular the introduction of enhanced UDAs to support higher needs patients. However, the reforms do not address my local dentist's concerns that the current system is based on rewarding reactive treatment rather than preventative, meaning that dentists are driven to do the minimum necessary to meet the terms of the target. This is a source of frustration for some who have expressed their preference for being remunerated for using their initiative and working in the best interest of their patients. Furthermore, while it is welcome that a minimum indicative UDA value of £23 has been introduced, UDA payments are not rising in line with increasing overhead costs, devaluing contracts, and in some cases, leaving dentists out of pocket. This was highlighted recently during a conversation I had with Bupa in Loughborough, who expressed that this is compounded by the fact that UDA payments vary geographically, with a UDA worth £36 in Sheffield practices, but only £24 in their Loughborough one. Finally, the reforms do not address the issue of dentists not being given leeway for the last-minute cancellations and no-shows in their contracts, even though these can lead to missed targets. I would therefore ask that this be urgently reviewed so we do not punish dentists for trying their hardest to continue to provide the care needed. It is clear that there is still a way to go to make NHS dental contracts more attractive in both terms of the nature of the dentistry performed and the level of financial reimbursement received for services performed. I fear that if the government does not continue to work at this speed, we will lose even more NHS dentists through early retirement, a reduction in time spent completing NHS work, or a full move into private practice. This would be detrimental to patient care and the availability of NHS appointments. I know that the former Minister of State for Health, my honourable friend, the member for Lewis, was working hard to review UDA contracts, and I would welcome confirmation from her successor that they will continue this hard work. As well as difficulties retaining dentists, I have been informed that locally we are having difficulties recruiting them. One reason for this is that there is no dentistry school in the East Midlands, our nearest being Sheffield and Birmingham, and that students are choosing to enter into the workplace close to where they study. This is causing supply issues in the NHS service and has created a gap in the market, which is being filled by private dentists with a focus on cosmetics. We therefore need to ensure we are training up enough dentists and providing them with incentives to move away from where they are studying to areas with greater demand. Bupa has also advocated for putting dental practitioners on the shortage occupation list in order to increase overseas recruitment to fill shortages and then upskilling them via short courses to meet UK standards. Please could the Minister comment on the actions being taken to increase the number of dentists from overseas? Finally, I am very concerned that NHS England has proposed closing the intermediate minor oral surgery services in Loughborough, meaning that local residents will have to go as far as Leicester for treatment, which is some considerable way away, and of course a cut in bus services has happened recently with the number 2 bus service in particular. Loughborough is effectively Leicestershire's county town, and so there is more than enough demand for the service. Closing the centre will only increase pressures on the Leicester Centre, extending waiting times and further impacting on patient care. This centralisation of services does not meet the needs of the patient, and I would ask that the Minister look at this with some urgency at local services availability throughout the country and especially throughout Leicestershire. And just finally, I would like to say, having listened to the whole debate today, it's very interesting because there were a small number of points actually that needed to be addressed that came across from all of the chamber and from all of the country. So I don't think that this is an insurmountable problem to solve, and I feel sure that the Minister will be able to address it. Thank you.
Shadow Minister Andrew Gwynn.
Thank you, Madam Deputy Speaker, and I'd